Today we're really opening up a bit of a black box.
It's a very important one.
Right. The mechanism right at the heart of the UK National Health Services budget, the thing that turns a patient's story into actual hospital revenue. We're talking about clinical coding. So our mission for you is to really break down the four-step coding process, the 4SCP. It's the mandated system for turning all this complex medical information into, well, standardized data.
And the stakes here are, they're just incredibly high. This isn't just about data management. The 4SCP is foundational to the entire NHS financial system, what they call payment by results.
So it's literally how the money moves.
Exactly. And when it goes wrong, the cost is staggering. You look at previous audits, they've estimated that coding errors have led to something like £1 billion in mistaken payments over certain periods.
£1 billion. Wow.
That number alone tells you this isn't just admin. It's a massive financial risk operation.
And to manage that, they're using two different standards, right? You've got ICD-10 for diagnoses and then OPCS-4 for all the procedures.
The twin languages, yeah.
Okay, so let's get into the actual process. Step 1, documentation analysis. It feels like everything really hinges on this first step.
It absolutely does. You know, if the source notes from the clinician, the discharge summary, if it's poor or it's vague,
then the whole thing falls apart from the get-go.
Completely. The coder is legally bound to only code what's explicitly recorded. They can't just guess.
Garbage in, garbage out.
Pretty much. But once they're happy with the notes, they move on. Step 2 is the lookup using both the alphabetical index and then the authoritative tabular list to find the right codes.
Okay, so that's the mechanical part. But where does the real analytical skill get tested?
Yeah.
The bit that's not just looking something up.
That would be step 3. This is the core challenge. Tentative code assignment and rule application. This is where coders have to apply these incredibly complex national standards.
DGCS, right?
DGCS, yeah. And a key one is something called the principle of totality. So say a patient comes in with a fractured hip. You don't just code the hip.
You have to get everything else.
You have to capture all the comorbidities, their longstanding diabetes, a heart condition, because all of those things affect the resources, the time, the cost of care.
I see. So if you've got all these different diagnoses, what is the single biggest judgment call that actually determines how much the hospital gets paid?
It's the sequencing. It all comes down to selecting the correct primary diagnosis, DGCS.1.
Oh.
That one decision, the coder puts first, feeds directly into an algorithm called the grouper. And that spits out a healthcare resource group, an HRG.
And the HRG is the payment.
The HRG is what reimburses the hospital. So that one analytical call by the coder literally directs the flow of money through the entire service, is why they all need that mandatory CCSC training.
It's a huge weight on their shoulders. They're sort of financial gatekeepers.
In a way, yes. And that brings us to the final check. Step 4, verification and validation.
This is more of a quality control step.
Exactly. A technical check to make sure the data is robust enough for the national processing systems, like SUS, the secondary uses service.
So things like formatting.
Precisely. Like some codes need a placeholder character, an X, to be the right length. It sounds so minor, but if that X is missing, the national system just rejects the entire record.
And the payment just stops.
Instantly. The data flow dies.
So, to bring this all together for you, the key takeaway here is that this four-step coding process, it's the essential engine that transforms human clinical care into data the system can use for money and for stats. Coders are these highly trained specialists, and the fiscal health of the NHS really does depend on their accuracy.
Which leaves you with a really interesting final thought, doesn't it? We keep saying poor source documentation is the biggest barrier to getting this right.
Right, the garbage in problem again.
So what if you could leverage newer tech, maybe even AI, to automate those simple technical compliance checks in step 4? All the boring stuff, like checking for that X-filler character.
You'd free up the humans to focus on the hard part.
Exactly. Yeah. You could let these highly trained coders dedicate their entire analytical focus to that really complex, high-stakes judgment call in step 3, the sequencing. You have to